You wake up at 2 in the morning because your dog is pacing beside the bed. He lies down, gets back up, stretches, turns in a circle, and looks at you as if something is wrong. Then you notice his belly. It seems larger than it did earlier. Maybe it looks rounded. Maybe it feels tight. Maybe he tries to vomit, but nothing comes out. You wonder whether he simply ate too fast, swallowed air, or needs to go outside. That moment matters. A swollen belly can be harmless in some dogs, but it can also be the first visible sign of a life-threatening emergency. The dangerous part is that several very different problems can look similar at the beginning. So, how do you know whether to monitor your dog? Call your regular veterinarian, or leave for an emergency hospital immediately. In this video, I will show you 3 belly signs you cannot ignore, the mistakes that cost precious time, and exactly what to do while arranging veterinary care. Stay with me for a simple routine that can help you notice changes earlier. Hi everyone, I'm Dr. Chen, your pet care guide, and welcome back to Dr. Chen Pet Care. Before we go further, I need to be direct. If your dog's abdomen suddenly becomes enlarged or tight, and your dog is retching, struggling to breathe, collapsing, acting weak, or unable to settle, do not wait to finish this video. Call the nearest emergency veterinary hospital and prepare to leave. Emergency information should never be hidden for suspense. Why a changed belly deserves attention. Your dog's abdomen contains the stomach, intestines, liver, spleen, kidneys, liver, reproductive organs, and major blood vessels. A change in belly size can happen because of food, gas, fat, pregnancy, enlarged organs, fluid, blood, urine, a mass, or a twisted and expanding stomach. A swollen abdomen is not a diagnosis. It is a visible clue. Some changes happen slowly, such as gradual weight gain and loss of the waist behind the ribs. Others appear quickly. A dog looks normal after dinner, then develops a firm or expanding abdomen within an hour. The speed of the change is one of the most important details. I want you to understand this. A dog does not need to have an enormous belly to be in danger. In deep-chested dogs, swelling may be more noticeable behind the ribs or on one side. Thick fur can hide the outline. An overweight dog may already look rounded, making new distension harder to see. Some dogs also become seriously ill before the swelling looks dramatic. Do not depend on appearance alone. Look at the whole dog. Is the belly larger than usual? Is it getting larger? Does it feel unusually firm without pressing hard? Is your dog restless, drooling, panting, retching, vomiting, trembling, guarding the abdomen, or refusing to lie down? Are the gums pale? Is breathing more difficult? Is your dog weak? Those combined signs matter more than belly shape by itself. Belly sign 1. Sudden enlargement or a tight abdomen. The first belly sign you cannot ignore is sudden enlargement, especially when the abdomen looks tense, feels firm, or seems to be expanding. One dangerous possibility is gastric dilatation volvulus, often called GDV or bloat. Gastric dilatation means the stomach has expanded with gas, food, or fluid. Volvulus means the stomach has rotated or twisted. This can trap material inside, interfere with blood flow, press on major vessels, make breathing harder, and lead to shock. Dogs with GDV may show a distended abdomen, repeated unproductive retching, drooling, restlessness, abdominal pain, breathing difficulty, weakness, or collapse. You cannot reliably tell at home whether a swollen stomach is simple gas, food distension, or GDV. That distinction may require an examination and imaging. Waiting to see whether the dog burps it out is not a safe test when the swelling is sudden or accompanied by distress. Deep-chested dogs are often discussed as higher risk, but smaller dogs are not automatically safe. Any dog with sudden swelling and concerning symptoms deserves urgent attention. The change may look like fullness behind the ribs, a rounded or uneven belly, or an abdomen that seems larger each time you look. Your dog may glance back at the belly, stretch, lie down, and immediately stand again, or seem unable to get comfortable. Restlessness may be the first sign you notice. Severe intestinal distension or obstruction can also cause swelling. A dog that swallowed a toy, sock, corn cob, bone fragment, or another object may develop vomiting, appetite loss, abdominal pain, lethargy, and a larger belly. Some dogs still pass stool early in an obstruction, so one bowel movement does not rule it out. A rapidly enlarged abdomen after trauma is also an emergency. Internal bleeding or leakage of urine may not be visible from the outside. If your dog was hit by a vehicle, fell, was attacked, or suffered another serious injury, a growing belly needs immediate care even if there is no obvious wound. The key question is not, does the belly look huge? It is, did this belly change quickly, and is my dog acting abnormal? If the answer is yes, call for help. Belly sign 2. Swelling with retching, drooling, or pacing. The second sign is abdominal swelling, combined with repeated attempts to vomit, heavy drooling, or constant restlessness. This combination is especially concerning because it may signal that the stomach is severely distended or twisted. A dog may lower the head, contract the abdomen, and make vomiting motions, but produce only foam, saliva, or nothing at all. This is called non-productive retching. Please listen carefully. Repeated retching without bringing anything up is not the same as an occasional cough, gag, or reverse sneeze. You may not know exactly which movement you are seeing, and that is okay. What matters is the pattern and the dog's overall condition. If the belly is enlarged and the dog is repeatedly trying to vomit, treat the situation as urgent. Do not spend 30 minutes filming the behavior, searching forums, or testing remedies. Take a brief video only if it does not delay departure, because it may help the veterinary team. Then call and go. Excessive saliva may appear as strings of drool, wet fur around the mouth, repeated swallowing, or puddles on the floor. Dogs can drool for many reasons, but drooling combined with a tight abdomen and retching is a major warning pattern. Restlessness is also easy to underestimate. A dog in abdominal distress may pace, repeatedly ask to go outside, dig at bedding, or refuse to lie down. Some owners assume anxiety or constipation when the dog is actually in pain. Here is where many pet owners make a mistake. They wait for crying before believing the dog is in serious pain. Dogs do not always cry. Some pant, some become quiet, some simply cannot settle. A swollen belly after access to trash, a large amount of food, raw yeast dough, or an unknown household substance also needs prompt professional advice. Raw yeast dough can expand in the stomach and produce alcohol during fermentation, leading to distension, weakness, abnormal behavior, and other dangerous effects. Do not induce vomiting unless a veterinarian or animal poison professional specifically directs you to do so. Before you try anything at home, there is an important safety warning. Do not give hydrogen peroxide unless a veterinarian has assessed the situation and given specific instructions. Inducing vomiting can be dangerous in some emergencies, and it does not fix a twisted stomach. Do not give oil, baking soda, vinegar, herbal mixtures, human antacids, or pain medicine. Natural does not mean safe, and treatment delays can be more dangerous than the original symptom. Do not massage or press firmly on a distended abdomen. You cannot manually untwist a stomach or identify internal bleeding with your hands. Do not offer a large bowl of food or water to test your dog's appetite. Follow the emergency clinic's instructions while you are traveling. Belly sign 3. A bigger belly with weakness or breathing trouble. The third sign is the most dangerous combination: an enlarged abdomen with pale or gray gums, weakness, collapse, rapid breathing, obvious breathing effort, or a dog who seems mentally dull or disconnected. These signs may mean the body is not circulating blood or oxygen normally. In severe GDV, an expanding stomach can interfere with circulation and breathing. Internal bleeding, heart disease, abdominal fluid, serious infection, trauma, and other conditions can create a similar pattern. This is not a wait-and-see situation. Look at your dog's gums only if you can do it safely. Healthy gum color varies, and some dogs naturally have dark pigment. You are looking for a clear change from normal. Gums that appear unusually pale, white, gray, or bluish, especially when paired with weakness or breathing difficulty. Do not force the mouth open if your dog is panicked, painful, struggling to breathe, or likely to bite. Your safety matters too. Breathing trouble may look like more than fast panting. Watch for the belly working hard with each breath, the neck stretched forward, elbows held away from the body, unusual open mouth breathing, noisy breathing, or an inability to lie down comfortably. A large abdomen can limit movement of the diaphragm, the main muscle used for breathing. Fluid in the abdomen can also create pressure. Right-sided heart failure is one possible cause of abdominal fluid, called ascites, but many other illnesses can cause it. Appearance alone cannot tell you why it is happening. Weakness may begin subtly. Your dog hesitates on the stairs, lies down during a short walk, sways when standing, or seems reluctant to move. It may progress to collapse. If a swollen abdomen is paired with sudden weakness, do not assume your dog is simply tired. An unspayed female dog deserves special attention. A serious uterine infection called pyometra can occur after a heat cycle. Some dogs have vaginal discharge, but with a closed pyometra, there may be no visible discharge because infected material is trapped inside the uterus. The abdomen may enlarge, and the dog may become lethargic, stop eating, vomit, drink more, or become severely ill. This requires urgent veterinary care. Puppies can develop a pot-bellied appearance from intestinal parasites, poor nutrition, or other problems. That often develops more gradually than GDV, but it still needs proper diagnosis and a safe deworming plan. Do not use livestock dewormers or random online doses. Different parasites require different treatments. The message is simple. A changing belly, plus changes in breathing, strength, gum color, or awareness, is an emergency pattern. The mistakes that make it worse. Now let us talk about the mistakes that cause owners to lose valuable time. I am not sharing these to shame anyone. You did not miss a problem because you do not care. Most owners were simply never shown what to look for. The first mistake is assuming every swollen belly is just gas. Dogs do get gas and may look full after a large meal, but you cannot prove that a tense, rapidly enlarging abdomen is harmless by waiting at home. When retching, pain, drooling, breathing changes, weakness, or collapse are present, the risk is too high. The second mistake is waiting for the regular clinic to open when emergency care is available. If symptoms begin at night, on a weekend, or during a holiday, call the nearest emergency facility. Tell them your dog's breed, age, approximate weight, symptoms, when the swelling started, whether the dog is retching or vomiting, and whether there was access to food, trash, dough, medication, toxins, or foreign objects. The third mistake is giving human medication. Ibuprofen, naproxen, acetaminophen, aspirin, and other products can cause serious harm. Do not give pain medicine, gas medicine, sedatives, or stomach remedies unless a veterinarian specifically tells you what is appropriate. The fourth mistake is forcing vomiting. It will not correct a twisted stomach, and it may create more danger after certain ingestions. The fifth is pressing or repeatedly measuring the abdomen. At home, your job is to recognize the change and get help, not reproduce a veterinary examination. The sixth is delaying because the dog briefly seems better. A dog may stop pacing because he is becoming weak, not because the danger has passed. Finally, call ahead when possible. The hospital can prepare, confirm availability, and give arrival instructions. What you should do first here is exactly what I recommend when you see a suddenly enlarged belly or one of the dangerous combinations we have discussed. First, observe for a few seconds. Is the abdomen larger than normal? Is your dog retching, drooling, pacing, panting, weak, collapsing, or struggling to breathe? Do not spend several minutes performing tests. You are gathering enough information to make the call. Second, contact the nearest veterinary clinic or emergency hospital. Use a direct language. My dog's abdomen suddenly looks swollen and tight. He is trying to vomit, but nothing is coming up. That communicates urgency. Third, follow the clinic's instructions and prepare for transport. Keep activity low. Use a leash for a dog who can walk safely. For a weak dog, use a blanket as a stretcher with another adult if possible, supporting the body without pressing on the abdomen. Do not put a tight muzzle on a dog who is vomiting or having breathing difficulty. Fourth, do not offer food, large amounts of water, medication, or home remedies unless the veterinary team tells you to. Do not delay departure to look for a supplement or try to relieve gas. Fifth, bring useful information. Know when your dog last ate, what was eaten, whether an object or toxin may have been swallowed, when behavior changed, whether vomiting or stool occurred, and which medications or medical conditions are already present. Bring productive packaging, if exposure is possible. Sixth, drive safely. Panic creates a second emergency. If another person is available, have them drive while you monitor the dog and communicate with the hospital. Keep the vehicle ventilated and avoid pressure on the belly. At the hospital, the team may assess breathing, circulation, heart rate, gum color, pain, and abdominal size. They may recommend imaging, blood tests, stabilization, fluids, pain control, surgery, or other treatment. Your job is not to diagnose the problem before arrival. Your most important contribution is recognizing the urgency. When a bigger belly is not a sudden emergency. Not every round belly requires an emergency drive, but every unexplained change deserves attention. Gradual weight gain usually develops over weeks or months. The ribs become harder to feel, and the waist becomes less visible. Even then, do not assume overeating is the only cause. Hormonal disease, reduced activity, medication effects, and other problems can contribute. A slowly developing pot-bellied appearance can occur with muscle weakness, enlarged organs, fluid, pregnancy, parasites, or masses. A dog may seem comfortable at first, but the change still deserves attention. If the abdomen is gradually enlarging, but your dog is breathing normally, eating, drinking, moving comfortably, and showing no emergency signs, schedule a veterinary appointment rather than trying to diagnose the cause online. Record when you first notice the change and whether there are changes in appetite, thirst, urination, stool, vomiting, coughing, stamina, weight, or behavior. Abdominal enlargement can result from obesity, intestinal parasites, organ enlargement, pregnancy, fluid, blood, urine, or other disease processes. Because the causes range from manageable to life-threatening, examination and testing may be needed to separate them. Soft versus tense can provide context, but do not rely on it. Pain, muscle tension, body condition, and the location of swelling can change what you feel. Also notice a new one-sided bulge or lump. It deserves veterinary assessment, especially if painful, rapidly growing, or associated with vomiting or weakness. The safe belly check routine. Now let us make prevention practical. Once a week, when your dog is relaxed and standing naturally, look from the side and from above. Learn the normal waist, the normal curve behind the ribs, and the normal way the abdomen moves during breathing. You are not looking for perfection. You are learning your own dog. Gently run your hands along the ribs and sides without pushing deeply into the belly. Your dog should not suddenly flinch, guard the area, turn to bite, cry, or tense in pain. Stop if your dog is uncomfortable. A home check is observation, not a medical examination. Keep a monthly weight record if possible, and focus on the trend rather than one number. Also notice appetite, thirst, urination, stool, vomiting, panting at rest, stamina, and comfort. These details help a veterinarian interpret a changing belly. For dogs that eat very quickly, discuss meal size, feeding schedule, and safe slow feeding options with your veterinarian. Avoid sudden major diet changes. Keep trash, raw dough, medications, toxic foods, and swallowable objects out of reach. Supervise dogs around toys, bones, fabric, and food packaging. Owners of higher-risk deep-chested dogs can ask their veterinarian about individualized GDV prevention, including feeding habits and whether a preventive gastropexy may be appropriate. A gastropexy is surgery that attaches the stomach to the body wall to reduce the risk of twisting. It is not right for every dog, and it does not prevent all stomach distension, so the decision should be specific to your dog. Most importantly, know where you would go during an emergency. Save the address and phone number of your regular veterinarian, the nearest after-hours hospital, and an animal poison service before you need them. Your simple action plan. Let us bring everything together. The first sign you cannot ignore is a belly that becomes suddenly enlarged, tight, or unusually firm, especially if it is still expanding. The second is swelling combined with repeated retching, heavy drooling, pain, or constant pacing. The third is an enlarged abdomen with pale gums, weakness, collapse, unusual breathing, or a dog who seems dull and unresponsive. For any of these patterns, call an emergency veterinary hospital immediately. Do not wait for the belly to become enormous. Do not give human medicine. Do not force vomiting. Do not massage the abdomen. Do not offer a large meal or bowl of water. Keep your dog calm, prepare for safe transport, and bring a clear history of what happened. For a gradual belly change, without emergency symptoms, arrange a regular veterinary examination and keep notes about appetite, weight, drinking, urination, stool, breathing, activity, and behavior. You know your dog better than anyone. When something feels wrong, trust your instincts and contact your veterinarian. It is better to make a phone call that turns out not to be an emergency than to dismiss a dangerous change because you were afraid of overreacting. Now I want to ask you one specific question. Have you ever noticed your dog's belly suddenly look larger, and what other behavior happened at the same time? Share your experience in the comments. Your answer may help another owner recognize a warning sign sooner. If this video helped you understand what to look for, please like it, subscribe to Dr. Chen Pet Care, and share it with another dog owner who needs this information. Give your dog a gentle scratch behind the ears for me. Stay observant, trust your instincts, and I'll see you in the next video.